Hi, everyone. My name is Jonathan Conrad. I'm president of ISF, and I want to welcome you to our webinar, The Calm Before the Storm. So thank you for coming. We really appreciate you being here. Very excited to share some information with you about the experiences we've had in emergency management and response. ISF has been working with state government and federal government for more than 40 years. And, the kind of lessons that we've learned as a company and organization and the team that we have supporting anything from National Guard to bureaus of preparedness and response to disease control. And you can imagine what this last year has been and the kind of experiences we've all had through this. And that's what we want to share today. What you're going to be hearing about is really a core of our services focused on the ingenuity and creativity that is required to manage and respond to an event, the logistics and planning that are necessary, and the technology and solutions that really support you as you go through there and support your team to be able to respond as quickly and effectively as possible. So again, I think you're going to be really encouraged by what you hear. We hope that it's helpful and that it really helps you as you try to plan for your organizations. And speaking of technology, I do want to introduce our sponsor and partner, Arrow. Arrow stands for Activate, Respond, Recover, and Operate. It is an enterprise-wide solution that really helps in your response and recovery, both tracking people, personnel, equipment, and reimbursements. So I want to be able to introduce Lawrence Salerno from our team from Arrow, and he can tell you a little bit more about that solution. Lawrence.
Thank you, Jonathan. I appreciate the warm introduction. As he said, my name is Lawrence Salerno, and I'm the client partner who is in charge of Arrow. And one thing that we've learned from the last 40 years of being in business and in 2020 in general is that emergencies can be chaotic and they can be crazy and they can be hectic and they are changing all the time. And the last thing that anyone wants to do is for administrative issues to become bigger than what the emergency actually is. And that's kind of why Arrow exists. It exists for three reasons: to care for your people, to respond better, and to recover faster. We originally started Arrow back in 2004 when we partnered with the Department of Military Affairs and the Florida National Guard after a very, very active hurricane season. I think they were active for a good 3 or 4 months solid, and it created a lot of administrative problems that Arrow came in and fixed. We came in and partnered with them, and they have been using this on every activation and emergency since 2004. Additionally, we've expanded, and Arrow is being leveraged by other states such as Texas, California, New York, Massachusetts, North Dakota, Washington, and just recently the state of Hawaii. Okay, so what does all this mean? What does caring for your people it means? Well, Arrow is a resource tracking and reimbursement solution. Resources, what do we track? We track people, we track equipment, and we track supplies. So it's knowing where your people are, what jobs they're performing, with what equipment they're using, and how much all of this is costing you in real time. It also allows for you to onboard and offboard your responders as quickly as possible. So that way they can get to the emergency where they're really needed, and then they can get back to either their normal blue sky job or their civilian job quickly and efficiently. Responding better, what does that mean? Well, Arrow is an enterprise-wide tool. So it connects your first responders or the people in the field with your HR, finance, accounting personnel, and your recovering specialist. It gives them a common operating language that we like to call Arrow. Lastly, recovering faster. What does that mean? Well, Arrow allows you to begin your recovery while you're responding to the emergency. It has accountability and auditability that allows you to know in real time how much the operation or the mission or the emergency is costing you. So that way you're able to start the claims reimbursement process while the emergency is going on. We're integrated, we're easily able to integrate into FEMA or other state systems that allows you to start the claims process quickly and more efficiently. One little like tool we like to say is that claims that used to take years can now take months. Months can now take weeks. Weeks can now take days. So what does it really mean to you? What are the benefits of it? It's real-time situational awareness. So there's no more running around from staff to staff, or asking where is this spreadsheet on the SharePoint drive, or where it is, or compiling them to get information. It's in real time, it's there in front of you, it's at your fingertips. You know where your people are, what jobs are performing, with what equipment, and how much it's costing you. It's also very, very useful for responder safety. You're able to send messages out to the field of things that are hurricane warnings or any sort of danger that they might be going into. So like we said, it also connects the responders to the field and headquarters. So it allows you to start the recovery process sooner. And lastly, Arrow is able to adapt to the unknown. It is not built for hurricanes. It is not built for wildfires. It is not built for COVID. It is not built for civil unrest. It's built for all of those and to run them all simultaneously. Arrow has the security that you would need, and it is able to change for the ever-changing landscape of emergency management. We would love to show you Arrow. My contact information is attached to this presentation, as well as you could go to the website to find out more about it, www.isf.com/Arrow. You can go there, schedule a demo. We would love to show you the tool. With that said, thank you very much for your time. I know I'm excited about hearing Christy. So with that said, Jonathan.
Awesome. Thanks, Lawrence and the Arrow team. Really appreciate you being a part of the presentation here. So yeah, without further ado, we want to get to the speaker, really to Christy Luce, who has joined our team. It's very exciting to have Christy a part of ISF. Christy actually retired recently with over 30 years of experience in state government work and leading major efforts from emergency response to hurricanes and other natural disasters to the recent COVID-19 response and any other disease control. She has a ton of history and stories that I know you're going to be very interested to hear, and very tactical steps that she can give you in terms of preparing for and responding to an event that you would deal with. So she is going to have a ton of the creativity and ingenuity that we talked about, how to develop plans, and really how to respond. So with that, I want to introduce Christy Luce, and take it away, Christy.
Well, thank you so much, Jonathan. My name is Christy Luce. I am a senior consultant here at ISF, a great company with a 40-year history of working with all kinds of states and agencies. A little bit of background about myself. I retired from state government in January of 2020. Before that, I was with the Florida Department of Health. So I retired from the Florida Department of Health. And when I was at the Department of Health, I was the Emergency Coordination Officer and the Chief of the Bureau of Preparedness and Response. And what we did there is, when we weren't actively responding, we were administering federal preparedness grants that totaled about $42 million a year, unless we got supplementals for things like Ebola and, of course, COVID. My last 2 years of my state career, I was sort of on loan to the Division of Emergency Management, where I was the Emergency Services Branch Director. And I coordinated the response for public health and medical, fire, search and rescue, hazmat, and law enforcement as well. Okay, so I want to thank everybody for spending your lunch hour with me. This is awesome. The theme of today's webinar is the calm before the storm. And I want to talk about 5 things that at least I think are important to consider going into hurricane season. So first, we have personal preparedness. Then we have employee burnout, COVID and its effect on the planning for other incidents. And we also have responder safety and health. And I'd like to go back just a second and say, I realize that not everyone on this webinar has a hurricane season. I know that we have inland states and some West Coast states on the webinar as well. Also, for some of you, this might be a little bit high level, especially those that aren't involved with the response on a day-to-day basis. However, I hope you'll find the message relevant and hopefully thought-provoking. Okay, so let's talk about personal preparedness. Personal preparedness is one of the most important things we're going to talk about today. And if you get nothing else out of this webinar, I want you to listen to the personal preparedness pitch. So everyone should have a personal preparedness plan, and that's a plan outlining what you and your family, including your pets, will do during an emergency. And that might be a house fire or a tornado or a hurricane or an earthquake. Personal preparedness plans should be updated at least yearly and shared with trusted friends and your family. So we are all obviously professionals here on the webinar, but we are also moms and dads and sisters and brothers and best friends. So it's so important to make sure that you have one of these plans. And this is not for people who are just in emergency management. This is for everybody. This is for people in that work for not-for-profit organizations or the private sector as well. So this is truly relevant for everybody. And why is it so important to have a personal preparedness plan? Well, you aren't at the top of your game if you're worried about your loved ones, including your pets. Houses and cars can be replaced. Your people cannot. So that's why it's important to get a plan, review it, and keep reviewing it. You'll find some great templates at floridadisaster.org, and that's Florida spelled out, disaster.org. These templates will ask you the questions that you'll need to answer to write a really thorough plan. So I'm going to ask two things of you. One, develop or update your own plan. And number two, encourage or yet strongly encourage your co-workers, employees, staff members to do the same. Because your personal preparedness plan just might have changed during COVID. So I'll give you an example of how my personal preparedness plan changed. So during Hurricane Michael, I was working in the State Emergency Operations Center here in Florida, and things were very tense. This storm had gone from a tropical cyclone to a Category 5 hurricane in like about 3 days, and this was almost unheard of. And this storm was absolutely barreling towards the Panhandle. My personal preparedness plan was to take my children over to my mom and dad. Luckily, they live here in Tallahassee. My spouse at the time was law enforcement, and he had his own duties. So we had always planned our kids would go over to my mom and dad's, which was great. However, as the storm intensified, I found myself not being able to concentrate on what needed to be done, and there was so much that needed to be done. And I realized the reason I was so agitated was my parents had decided not to evacuate. Thankfully, after the 11 p.m. National Hurricane Center update, they changed their mind and set off for the East Coast with my twins, a friend of theirs, my 160-pound Great Dane, and my mom and dad. So once I knew that they were safe and sound on the East Coast, I could sort of, okay, let's focus on all the stuff that needs to happen. So what's interesting though, is that plan would not have worked in 2020. Obviously, my parents were older. They hadn't received the vaccination. And so that it just wouldn't have worked. I couldn't take my kids over there. Luckily now, and things are changing so fast. Luckily now, a lot of people are vaccinated. My parents included, thank God. And so our personal preparedness plan has kind of went back to where it was before COVID. So that's good. So here's my last pitch on preparedness plans. Everyone who works should have a continuity of operations plan. And this is for businesses and organizations. And essentially, this COOP plan, continuity of operations plan, tells your employees what to do in the case of an emergency. So maybe your regular building is on fire and you need to let your folks know, don't come there, go over here. Perhaps it's all your servers went down, or really it could be anything. Also, we need to make sure that you have orders of succession, that you know who is supposed to be in charge. In our case, here at ISF, if Jonathan got twirled up into a tornado and was incapacitated, we would need to know, based on that order of succession, who was in charge then. And then, of course, those have to be shared with employees so that everybody is on the same page, everybody understands the communication processes, and it makes everybody a lot safer. All right, employee burnout. So there was a Berkeley study of COVID responders in October of 2020. And a lot of these people said burnout was their biggest issue. And is the stress of another response going to be the last straw for some of your people? Many agencies have been at a level 1 response for over a year. Organizations have been dealing with this, not just emergency management. You've all responded to COVID in some way or another. For better or for worse, I will tell you, I am not the same person that I was in 2020. And what made us change? I think ultimately, what made us change were several things, starting with distractions. So the surveyed folks said that their largest distractions, things that kept them from being able to concentrate, were fear of getting COVID, working really long hours, the general sort of state of the world after the pandemic hit, fear of spreading COVID, and the ever-present family and personal issues, which is totally understandable. Overall, survey participants said they were overwhelmingly burning out. 84% said they were mildly burned out, and 18% said they were completely and totally burned out. And why were they burned out? Well, sleep deprivation for one. 90% reported getting less than the recommended 8 hours. Shockingly, 1 in 3 reported receiving 4 hours or less. And I can tell you that since the advent of the cell phone, you're never able to detach from a response. I know that I got calls late at night, early in the morning, and I know that the ESF 8, the public health and medical folks, they were getting them all the time. So there's really no real way to pull away, relax, and recharge. Additionally, they felt like their work performance was decreased. They were making mistakes at work, and what they said caused these was sort of the combined stress with being thrust into this pandemic that is probably very unfamiliar territory for most folks. Nobody, and certainly I, didn't think that we would be, I would have to know about epidemiology and case counts and contact tracing and the correct color of medium and test tubes. But all of a sudden, here we are, and it can be very overwhelming. Nearly half had thoughts of quitting. I can understand this. Many of them said they were either going to retire, quit their jobs, or just change their careers forever. On a personal note, I promise you, I saw many people at the State Emergency Operations Center announce they were quitting, rip off their badge, throw down their keys, storm out, only to return about 30 minutes later and unquit. So definitely it's crossed people's minds, obviously not everybody acting on it. The next thing is significant deterioration of mental health. Actually, let's go back. I want to go back one time to thoughts of quitting. And I need to tell you that we lost several employees in the Bureau of Preparedness and Response during the COVID response. A lot of them left due to burnout. Some of them were sick of working these ridiculous hours. Some of them got a job with an agency that didn't have such a big role in the COVID response. Some got better offers from other state agencies. Some were gobbled up by contractors. And when, the choice is, stay and be super stressed for X amount of money, or go into the private sector and make 3 times that money or 2 times that money. I mean, I think for a lot of people that the choice is clear, and there's certainly no bad feeling, certainly no blame for anybody that left. So we did really everything we could to facilitate people's needs when COVID started, and actually as it kept progressing. So I met with the State Emergency Operations Chief, the CERT Chief, which is in Florida, essentially our incident commander. And we sort of spitballed some ideas, could we hire teachers to come and in these now empty state offices around the State Emergency Operations Center, could we set up classrooms? It didn't pan out, but we definitely tried to find ways that people would know that their children were safe and being watched, and they could still do their job as well. Obviously, there were some things that we couldn't control. In the beginning, there was just no getting over the crazy hours and the stress. That's just how it was. And the staff who was not in the Emergency Operations Center, or what we call like our auxiliary public health EOC over at the health building, which is about 2 buildings over from the State Emergency Operations Center. If you weren't working in one of those 2 things, you were allowed to work from home, which really made a difference. Absolutely. After the initial chaos of COVID, the big thing for me was trying to get folks a day off. And I will reiterate over and over what responders, especially my peeps at Department of Health, I wanted them to understand that they were having a direct positive impact on people's lives. They were saving lives, and they were just not getting the recognition that they deserved in the media, because unfortunately, mistakes or perceived mistakes are what the media likes. And so these guys were doing such a great job that, they weren't making headlines. So it was very important to me to make sure that they knew that they were valued, and that they were appreciated. And I tried to tell them, you are making history right now. You literally are making history. You will be able to tell your grandkids, your great grandkids, that you had a significant role in the COVID response of 2020. So moving on, let's see, significant deterioration of mental health. We got about 48 people that said their mental health had deteriorated. Days without sleep, high stress environment, and sometimes being asked to do, let's say, impossible feats. And I think right now might be a good time to bring up the fact that COVID was and still is a very, very political response. You know it, and I know it, and everybody else knows it, and to ignore it would be naive. So what I saw were some people caught between what they considered acceptable public health or emergency management practices and what they were being asked to do. These people legitimately want to do their job. They did not go into state government for the fame and the glory, maybe for the insurance and benefits, but not for the fame and glory. They're there because they have a heart for public service and they want to do the right thing. So really, folks just had to drown out the politics and focus on the task at hand. These people are problem solvers, and they will solve the problem no matter what it is. Additionally, directives from on high typically came with, and this must be implemented by the end of the day, which in some cases would have taken a miracle. Or it would have taken a group of people working all night to get things in order and sort of performing that little miracle and getting the job done. It was very impressive. I was very impressed with how excited people were to make these colossal events happen in such a small time. I try to be cognizant of people in the State Emergency Operations Center who seemed sort of close to that point of losing it. If it was possible, could they get a day off? Some of them honestly couldn't. But when we actually got to the point where COVID had slowed down a little, it was time for people to take a day here or a day there. And I'll be darned if everybody I told to take a day off fought me. They didn't want to leave. They wanted to stay. They felt an obligation. They wanted to stay and fight the good fight. So that was always a struggle, certainly during the beginning. And unfortunately, real life went on as well. The stressors of real life. We had a very well-liked young man, just amazing potential, working in our state logistics unit. And unfortunately, he was killed in a car crash. And seeing the pain and the sadness on people's faces for so many days was just absolutely heartbreaking. So an employee assistance program is great. Highly recommend them. But they're kind of difficult to manage when you don't even have time to go to the bathroom. So now switching over, conversely, when I retired, I went from this super interactive, high intensity workplace to working from home by myself, communicating primarily through Teams or email. Folks, I'm an off the chart extrovert, and I couldn't see anyone. I couldn't go anywhere. I couldn't do anything other than work. And that really had a negative effect on my mental health. Most folks said that they were more emotional at work. About 50% of nurses surveyed said that they had cried at work, which is fine. However, just like in baseball, there is no crying in emergency management. So I actually didn't see people crying, oddly enough. What I did see, there were quick tempers and exaggerated sensitivity, and from time to time, even some hostility. And I'm guessing you probably had similar experiences yourself. So response can be so tough on emotions, but there's no time to deal with them. There's a job to do. I will tell you that during the response to the Pulse nightclub shootings in 2016, I was at the State Emergency Operations Center, and there were only a few of us there from public health. We had deployed our Florida emergency mortuary operations and response system. Sorry about that, FEMORS. A group out of University of Florida, and they had gone down to the scene at the request of the district medical examiner and the current state surgeon general at the time, Dr. Celeste Phillip. And so what you have, let me sort of describe our EOC for just a second. So there's these 5 ginormous screens that go across the whole back wall. And where there's not a screen, there's a TV on the side. There's TVs in the hall. I'm surprised they don't have one in the bathroom. Anyway, what I got all day was this continuous loop of people being, these victims being placed in the back of a truck, or scenes of people gathered around the club, people waiting in line to donate blood, interviews with victims' families, interviews with law enforcement, and the running death counts. And it was kind of interesting. Our vital statistics unit worked with the Florida Department of Law Enforcement to produce any public documents related to the shooter. And so seeing those documents was very surreal and profound. I found it hard to associate this paper with a person that could do, this terrible, terrible thing. So all day though, I was all right. I was fine, no problem, doing my job. Then when it was time to leave that evening, I got in my car and I pulled out of the parking lot and I absolutely burst into tears. All of those things that I had seen and I had heard, I had put in a box. And then when I was alone, that box opened. And I was very shocked because I am not a crier at all. And so I think it was just my mind and my body probably needing that catharsis of saying, get all this out. And it worked. I went back to work the next day. Everything was fine, good to go. I will say, I think the effects of COVID have manifested slower, obviously, but they're there nonetheless. I mean, if you watch TV, you're seeing personal stories of loss, Facebook, scenes of patients on ventilators, and of course, that ever-present death count. So not to recognize that COVID can have such a effect on your mental health would be ingenuous. All right. So what can we make of all these surveys and observations? Well, I think in the emergency management field, what we're going to see is a mass exodus that's either taking place or has taken place. And that's difficult for business because loss of an employee takes 6 to 9 times their salary to replace them, if you can replace them. For instance, the person that was running ESF8 for most of COVID, especially during those several months at the beginning, finally left. She just kind of quit one day, not on bad terms at all. She had young children and a family, and she frankly just wanted to reconnect with them. But this girl was, she was something else. She was just a wealth of institutional knowledge. She had drive, she had ability, she got things done, she knew where the bodies were buried. And so when she left, we really felt that loss. I'll also tell you that my counterparts in other states in FEMA Region 4, which includes Florida, Alabama, Georgia, Mississippi, Kentucky, Tennessee, South Carolina, and North Carolina, many of the folks who had my position in those states, they left or they retired or they took other jobs because it was just so difficult to deal with everything they had to deal with. Definitely, these were people that I had, I'd seen them and been friends with them for years and years at conferences and, all these different things. And when they were gone, I realized, I might not see any of these people ever again because that relationship had unfortunately broke. Finally, when we talk about business and what this means for business, again, like I said, it's a money thing on one hand. It does take a lot of money to get someone rehired. But that's if you can do that. So when we're in the State Emergency Operations Center responding, there is no time to write an advertisement, advertise the job, and scan the interview applications and schedule interviews and hold interviews. And then, no offense, state government, but the achingly long time it can take to get someone hired. So that really wasn't even an option most of the time for us. And so unfortunately, what happened was work had to be distributed among already overworked folks. Then you factor in the loss of soft skills, and this could be morale, productivity, We've talked about hiring and onboarding time. And then, of course, the cultural impact on the company. So now I think it's important that we think about how COVID has changed and will change future responses, which could mean hurricanes, other severe weather. Last year, we had the formation of a lot of tropical storms and hurricanes. Thankfully, none of them, although a few affected Florida, we didn't have like a terrible storm. And so we were faced with this, well, what if we do have to shelter people during COVID? In response to that, CDC issued interim guidance on sort of congregate versus non-congregate sheltering. And what that means is congregate sheltering could be a civic center or a school gym, a large area, while non-congregate sheltering would be dorm rooms or hotel rooms, so people separated by legitimate walls. And while the guidance was great, unfortunately now, it's kind of obsolete. And I would expect to see CDC potentially put out another guidance document. So things you sort of need to think about when we're thinking about congregate versus non-congregate sheltering. Are the shelters that are established now, are they adequate for that CDC guidance? Because there is a lot in there about distancing people in congregate sheltering, distancing people and, trying the best that you can to keep them separated. Would the clients have to show proof of inoculation or vaccination? Are you going to perform testing at the shelter? And finally, do you have an adequate supply of personal preparedness equipment for your staff, your volunteers, and your clients? Additionally, we have the Emergency Management Compact. We call it EMAC. And this is basically a system that we use where we can request help from other states. The other states, it actually goes through an intermediary. And we typically get teams of people. So teams of nurses, teams of search and rescue, and incident management teams. So these teams that come over, we have enjoyed, we have a very strong relationship in Region 4, FEMA Region 4, the southern states. And, we were definitely able to call them even before we started doing the official paperwork and say, we would start having calls with them almost immediately. And they would actually have people rostered and ready to go, just waiting for that signature. And so, do we have, or do they have responders that they can send now? People are tired, they've been working hard. Should we require proof of vaccination? It's just really hard to say. We've applied really heavily on the EMAC system in the past when we didn't have the ability, when our resources here in Florida, state resources and local resources had really been exhausted. So next I want to talk about a few considerations for long-term care facilities. So last year, during the hurricane season, nursing homes and assisted living facilities, long-term care facilities, most of them stayed put. Thankfully, during any of the storms that affected Florida, nothing was so bad that they would need to evacuate. Either way, the plan was they were going to shelter in place. And the reason for that is because the sister facilities that they were going to evacuate to didn't want them. This was right in the middle of COVID. These prearranged agreements all of a sudden didn't mean anything, and they couldn't take them. And so luckily, we didn't have any major storms, but what we really want to think about is this year. So because they didn't evacuate last year, is there going to be some complacency on the part of these facilities? And really more of an opt for a shelter in place, even if we have a serious storm. It's hard to say. This is a very difficult decision. I have thought about the people making these decisions for quite a long time. So on one hand, you want to be safe. You want your people to be safe if there's any question that they could get hurt. On the other hand, you've got traditionally elderly people in nursing homes and living facilities that some are ambulatory, some are not, and you take them out of their normal environment, put them onto an ambulance or a bus, and truck them off to a new place that they're not familiar with. And this can actually have really, really detrimental effects on their mental and physical health. Patients can quickly deteriorate under these circumstances. Also, it's very expensive to evacuate. Patient transport is not cheap, and that's only one part of the picture. So it's important, I think, for counties to, cities and counties to look at the long-term care facilities in their jurisdiction and sort of go over their emergency plans for this year and see, are you still, because COVID is still technically, we are in a pandemic, are you going to shelter in place, or have you and your sister facilities worked out where you can evacuate? Next, the real fun of conducting more than one incident at a time. Do you have the resources to do that? At Department of Health, we had at least one incident management team up and running pretty much since February of 2016, when Zika hit. Not all of these incident management teams rose to the level of a state activation. They were primarily contained within health or within health and another agency. And the ones that, that didn't rise to the state level, activation level, were seasonal flu. We had a hepatitis A outbreak in the state. I think we actually still have it going on. And then like harmful algal blooms as well. So during the same time, so we're looking at 2016 to the end of 2020, we had 4 major hurricanes happen. Matthew, that skirted the entire east coast of Florida. Irma, which was ginormous. 66 of 67 counties were included in the executive order. 1 week later, Maria hit. It did not hit Florida, but Florida ended up getting sort of an onslaught of an influx of about 300,000 folks from Puerto Rico coming into Florida. So that was an interesting challenge. And then finally was Michael, and this was the first Category 5 to hit the United States since Andrew in 1992. So we seemed like we were constantly sort of juggling responses. Now, in almost all of these examples, Florida did not have the resources necessary to fulfill its statutory obligation, specifically for coordinating staffing in special needs shelters. And special needs shelters in Florida are places where people who live alone during the day can go and receive a modicum of care. So we typically always had to hire outside nurses. Do you have policies and guidelines for quickly onboarding supplemental staff like nurses? With all this turnover, have you had time for trainings? What does your staff know to do? Does your staff know what to do during a response if they've never worked anything but COVID. And then certainly you want to update job action sheets and playbooks. So finally, we're looking at responder safety and health, and we all adhere to the premise of the protection of life, protection of property, and protection of the environment in that order. But things you really need to know are, where are your responders? Do you know where they are? How many are at each site? Are they okay? And the reason for this is because those questions are going to be asked by the governor's office and the press. So better to go ahead and have that ready to go. I will tell you there are many things that you can use to track people. You can use spreadsheets, you can use access databases, but I encourage you to work smarter, not harder. Systems are available, Arrow being one of them, that can do these things, that can track responders, that can put them on a GPS map, that can ask them questions when they come back, demobilization questions. Did you wade through any nasty bacterial water? Are you hurt? And then finally, about mental health, because not everybody's comfortable saying to someone, yeah, I got a little wigged out there. They're much more apt to type that into the application if they don't know the person. So here we are, action items. Sorry, I'd gotten a little excited and ahead of myself. I want to go through, and I tried to pick out some action items from everything that we've talked about today. So number one, like I said, so important, develop or update your personal preparedness plan and make your coworkers do the same. Second, make sure your organization has a COOP plan. That keeps everybody safe. Be mindful and watchful for employee burnout. Very importantly, monitor your own mental health. You might not even know that you're feeling feelings. So take a real effort to be cognizant of how you feel. Do your best to retain your productive and positive employees. Ensure that you know your jurisdiction's plan for sheltering. Find out if long-term care facilities and hospitals in your jurisdiction have changed their emergency plan due to COVID, because it's quite possible. Ensure your organizational policies are conducive to quickly hiring additional staff during an event. If they're not, either change the plans, either temporarily change them, waive some requirements, whatever, but what do you have to do to get people on quickly? Also, update your response roster. Ensure that new employees or new staff members know what they are expected to do during a severe weather event. Always know where your responders are for timely situational awareness. And really, most importantly, treat your responders well. Ensure for the provision of food, shelter, and safety. If responders don't feel that they were valued or taken care of, they probably won't deploy again. So that's it for my slides. I am going to turn it back over to our moderator, April Dietz, and I think that there might be some questions.
Thank you, Christy. Again, everyone, the Q&A button down at the bottom is available to you to ask any questions during this time. We do have a couple of questions that came in. So the first question reads, what can be done to alleviate some of the stress in an EOC during the initial chaos of a response like COVID?
That's a really good question. And the answer is sometimes nothing. Sometimes it is just chaotic and crazy. I will tell you though, during COVID, people were allowed to bring their small dogs to the State Emergency Operations Center. It's kind of bizarre, but it was also kind of soothing. You could take a few minutes and play around with this little puppy or whatever, and that really, and I think studies show that has a calming effect on people. My second answer is probably kind of funny, but it's true, and that is food. So we were always fed at the State Emergency Operations Center. They catered stuff in, which was great. And we would get very excited about certain days or whatever. But the real thing that meant the most was we had a tropical smoothie here in Tallahassee. Donate, just bring over all of these smoothies. And some of us were just weeping on the floor because someone had acknowledged all this hard work. And that just felt so good. I mean, it just definitely brightens your day and you feel valued. Next question.
Thank you. Another question for you. Can you provide some advice for how to use volunteers in an emergency response, and especially considering COVID restrictions these days?
Sure. There is a federal program called the Medical Reserve Corps that is volunteers who, most of them have a healthcare background. A lot of these folks have retired from healthcare positions. They can be used to perhaps, put flyers on doors to ask people, to get vaccinated. Here's the facts, and here's where you can get vaccinated. Volunteers, without a doubt, saved COVID. They saved the whole United States. The not-for-profits that were dropping off meals to people who could not come out. And, once it was just a small amount of people that were sort of homebound. And overnight, it seems like we went to everybody was homebound. And these people really took it upon themselves. And I just can't imagine, I cannot express how awesome it was to see these volunteers over and over, getting stuff out there, helping people out. And so I think that it is definitely important to use volunteers.
Excellent. Thank you so much. We have time for a couple of more questions, but again, please feel free to drop your questions in the QA button down at the bottom. Your chat is disabled, but you do have access to that Q&A section, and we can follow up with you afterwards for any questions that went unanswered. Christy, what resources might come from the state level to help if another pandemic were to occur?
What resources would come from the state level if we were to have another pandemic? Well, that is, if somebody knew the answer to that question, they'd be a rich person right now, because I don't think we know. Everything's different. The chances of us having another COVID pandemic, I'm not an epidemiologist, but my guess is we're probably going to see something different, maybe a different pandemic. And that virus is going to have its own special attributes of how it spread, how quickly or easily it spread, the time it takes from the time it enters your body to when you actually start to show symptoms and things like that. So everything's different. And again, in emergency management, the mantra is Semper Gumpy, always flexible. So I think we are flexible. I will also tell you, though, we have warehouses and warehouses full of basic medical supplies. The Department of Health has warehouses in the north, central, and south part of the state. Things that we would need at special needs shelters, things that would be needed at hospitals. The Division of Emergency Management as well has more food and water than I can even say. It's in a building the size of a Costco in an undisclosed location. But yes, they as well keep a lot of stuff ready. We have ventilators just in case, and so generators just in case. So I think we've done the best that we can to anticipate the what might be next.
Awesome. Thank you again, Christy. I think we have time for one more question. What are some industries that are currently doing a great job at emergency preparedness?
What industries?
Mm-hmm.
Okay. There are very many. I will tell you that the energy industry, no matter which company we're talking about, they have their stuff together, and they really, really know how to. They know how to communicate. Even the fact if there's an outage or a huge outage, they're very good at communication. They're always communicating with us in the State Emergency Operations Center. They actually come to the State Emergency Operations Center. Also, within the private sector, you've got your Publixes and some of the other Airbnb. We've worked with lots and lots of private companies. This actually happens in what we call ESF 18. And so they have worked and worked and worked. And when we needed something, these folks had the contacts to say, is this a thing? And places like Publix have, obviously, they have a very good emergency management plan, because usually Publix is the only place you can sort of get anything to eat. They use generators and have been very gracious with that. I would say not-for-profits, folks with that deal with Florida's aging population. Most of them ensure that the people that they service have a personal preparedness plan that includes where this person's going to go, all the medication they need to take with them, how they're going to get there. So they've actually done a really good job with that as well.
Thanks, Christy. We are going to slide in one final question for you. So,
Okay.
How do you suggest to counter or deal with the political responses to emergencies?
How to deal with them. Again,
how do you suggest to counter and deal with them?
Any suggestions on how to deal with them? Okay. It's a sticky wicket there. The politics are the politics, and even sometimes if it does not feel right, we have a job to do. That said, I would not advocate for anybody to do anything that they found unethical or illegal. Many of us serve at the will of the governor. I definitely did. All of the Division of Emergency Management does. So it's very interesting when you think about it, and you've got all these people, and sometimes even those people don't know, they're fighting amongst themselves, and you really don't know what's going to come out of any of it. But as far as dealing with politics, I think definitely keeping calm, and really looking inside to decide, whether this is something you can do or something that, you would find unethical or, heaven forbid, illegal. And it helps to go outside and pet a dog.
Wonderful. Thank you so much. So that concludes the time that we have for Q&A right at this moment. But again, please feel free to, with the time remaining, ask those questions, and we'll respond to you at a later time.
I think we're going to kick it back over to Jonathan. There we go. So hi, everybody. This is Jonathan again. I want to thank you so much for participating in this webinar. I do want to let you know that, and thank you, Christy, for all the information. And again, I did want to let you know, we did have some questions asking if we would be sending out this presentation in full, and the answer is yes. And also, this has been recorded. We will send that out as well. So you will have access to the slides, the action items, and other information that Christy has provided. We will get that to you. And lastly, we just want to say again, thank you so much for allowing us to be a part of your day and be able to share this information with you. Look, I know you're here because you care, and you want to be able to respond effectively in your organization, and you want to know the lessons that we've learned and can we share with you. So I hope this was helpful. I really look forward to continuing to partner with you as you go forward. And ISF is here for you. We want to be able to provide you additional, just our experience, the lessons we've learned, the services we can provide around planning and preparation and technology and solutions. We get it. We know that these emergencies require a lot of creativity and a lot of planning. And we've done this for a very long time. So we're happy to provide information. We're here to be a resource too. If you just have a question and you want to reach out to us, here's our information. We would be happy to help you, just answering questions, putting you in touch with Christy or any of our team at Arrow. We'd be happy to talk with you about that, and we look forward to hearing from you. So again, thank you so much. I'm so glad you made it to this webinar. Hope it was helpful, and we look forward to talking with you. Have a great afternoon.